Today, I will be giving a brief overview on food and nutrition during chemotherapy. After watching this video, you will understand the importance of having good nutrition, how to prevent malnutrition, and what kinds of food you should include in your diet during chemotherapy. I will also share with you some tips on food safety to reduce the risk of food poisoning. Why is having good nutrition important? Having good nutrition helps you to better tolerate cancer treatments by maintaining your body's strength and energy, supporting your body's immune system to fight infections, and allowing your body to recover quicker from the side effects of chemotherapy. Having sufficient nutrition also helps to prevent unintentional weight loss and malnutrition. What is malnutrition? Malnutrition happens when you do not eat enough to provide your body with its daily needs. This results in unintentional weight and muscle loss. The amount of nutrition you need may also increase due to cancer or its treatment. 1 in 4 patients with cancer suffer from malnutrition. Malnutrition can happen to anyone, regardless of your size or whether you're overweight or underweight. As you lose muscle, your strength and immunity also becomes weaker. How do you monitor for malnutrition? You should weigh yourself weekly to ensure you are not losing too much weight during treatment. Losing weight too quickly can be a sign of malnutrition. Check if you experience significant weight loss of 3 kilograms or more within 3 to 6 months, or if you have been eating lesser than before, for example, eating less than half of your usual intake of 5 days or more. Do inform your doctor if you experience any of the above. Your doctor can provide you with advice or refer you to a dietitian who can support you to prevent or manage malnutrition. What happens during malnutrition? Malnutrition can increase the side effects of chemotherapy, which can in turn weaken your immunity and reduce your body's ability to fight infections. This can increase your risk of getting hospitalized from an infection or reduce your tolerance to treatment. Malnutrition can also slow down wound healing, which can be a problem if the wound becomes infected. What you should eat to prevent malnutrition. You should eat sufficient amounts of carbohydrates and proteins to maintain your body weight. Carbohydrates help to provide you with energy. Examples of food rich in carbohydrates include rice, corn, noodles, bread, and oats. Proteins help to build muscles and strength. Examples of food that are rich in proteins include chicken, fish, pork, eggs, and cheese. Healthy oils can be used for cooking or added to food for extra energy. Examples include canola oil, sesame oil, olive oil, and sunflower oil. It is important to keep yourself hydrated. You should drink enough water, at least 6 to 8 glasses of water per day, to maintain adequate hydration during treatment. Water should be boiled and be allowed to cool to room temperature before drinking. It is also safe to drink bottled mineral water. If you have been informed by your doctor of any fluid restriction, please keep to the fluid intake recommended by your doctor. You should consume caffeinated beverages in moderation. Caffeinated beverages such as coffee, tea, and cola contain caffeine, which can make you urinate more frequently. This may result to dehydration if you drink too much of it. You should include fruits and vegetables in your diet. Eat sufficient fruits and vegetables that can provide you with vitamins, minerals, and fiber to prevent constipation during chemotherapy. If you have been informed by your doctor to restrict your fiber intake, please follow as advised. You may ask your doctor to prescribe you with medications that will help you in case of constipation. It is also important to wash all fruits and vegetables thoroughly and to peel off the skin of fruits before eating. What should you avoid during treatment? Certain fruits, especially grapefruit, should be avoided as they may interfere with removal of some types of drugs from the body. This may lead to an increase in side effects if the drugs cannot be properly removed from the body. Other fruits that may also interact with treatment and cause problems include pomelo, pomegranate, and starfruit. Hence, these fruits are not recommended to be consumed during treatment. Several oranges, also known as bitter orange, should also be avoided during treatment. You should also avoid consuming excessive alcohol that may damage the liver, as the liver is important in helping the body get rid of the drugs after you have received treatment. Traditional Chinese medicines that may interfere with the effects of the treatment or increase the side effects should be avoided as well. Over-the-counter supplements and herbal products such as black cohosh, echinacea, garlic extract, green tea extract, ginkgo biloba, ginseng, milk thistle, mistletoe, and St. John's wort should all be avoided during treatment for the same reason as traditional Chinese medicines. Remember, products that are natural does not mean that it is safe for consumption, especially during treatment. This list of supplements or herbal products is not exhaustive. Do consult your doctor or pharmacist if unsure. Next, I will be providing you with some tips on food safety during treatment. Cancer treatments can weaken your immune system. This makes it easier to get food poisoning, especially if there is poor food hygiene and habits. However, food poisoning can be minimized through proper food handling when preparing a meal, eating safely, and buying outside food or meals that are freshly prepared. What is food poisoning? Food poisoning is caused by bacteria or viruses found in raw, undercooked, or unclean food. Common signs and symptoms of food poisoning include fever with a temperature of 38 degrees Celsius and above, vomiting and diarrhea, such as passing soft or watery stools more times than usual. If you have a stoma bag, you may also notice an increase in the contents of your stoma bag and having to change the bag more frequently. Other symptoms include abdominal pain or stomach cramps. If you develop any of the signs and symptoms above, you should proceed to the emergency department immediately, as you may have an infection that needs to be treated immediately. To reduce the risk of food poisoning, you should observe the following food safety measures when preparing food at home. Always wash your hands with soap and water right before preparing food and eating. Wash fruits and raw vegetables thoroughly with water and check for any signs of mold or rot. Discard any food that has turned moldy. Remember to check expiry dates and discard any expired food products. Thaw frozen food overnight in the refrigerator or in the microwave. Avoid thawing food at room temperature, as bacteria may grow on the food during the thawing process. Cook all food thoroughly, especially meat, poultry, eggs, and seafood. Check that the center of the meat is well cooked and not pink at the center. It is recommended to serve food hot and immediately after cooking, and to cook fresh meals if possible. Make sure that you wash all utensils such as spoons, forks, and chopping boards before cooking and eating. Use separate chopping boards for raw meats and fresh produce such as fruits and vegetables. When storing food, ensure raw meats are stored separately from fruits and vegetables in different compartments in the refrigerator. When storing food, it is best not to consume the leftover food if possible, as this may encourage bacterial growth and cause food poisoning if the food is not handled properly before eating. However, if eating leftover food cannot be avoided, the food should be properly stored in the fridge and is best consumed within the next day after reheating. If you need to prepare for more than one meal at a time, the freshly prepared food should be stored in the fridge or freezer within 1 to 2 hours after cooking. Leftover food stored in the freezer may be kept for 2 to 3 months, depending on the type of food. When reheating food and leftovers, it is important to reheat them on the stove, oven, or microwave until piping hot, or bring soups, sauces, and gravies to a boil to effectively kill any bacteria on the food before eating. Reheating until the food is warm does not mean that it will be safe to consume, as bacteria on the food may not have been killed if the temperature during the reheating process is not high enough. In general, all leftovers should be reheated until the core temperature of the food reaches at least 75 degrees Celsius. Measuring with a food thermometer is the most accurate way to judge whether the food has been thoroughly reheated if you are unsure. Keeping the kitchen clean will help reduce the chance of food contamination. Always use paper towels to wipe the wet surfaces in the kitchen, and keep the cooking area dry as bacteria can grow on wet surfaces. Remember to change the cleaning sponge every 2 weeks and to squeeze out all the water from the sponge after each use. If you are using a cloth towel, wash it frequently with soap and soak in hot water to kill any bacteria that may be growing on it. When buying food outside, here are some do's and don'ts to follow. Firstly, buy food that is hot and freshly prepared. For example, rice or noodles in hot soup, fully cooked eggs. Secondly, buy whole foods. Remember to wash and cut fruits at home just before eating. Avoid eating raw or uncooked food such as sashimi, rare steak, runny yolks, salads, rojak, soft-boiled eggs or poached eggs. Also do not eat cut fruits from fruit stalls. Buy canned drinks or packet drinks and bread that is individually packaged. Do not add ice cubes from drink stores to drinks, as the ice cube may not be clean. Also, do not buy bread that has been left on display and not individually packaged. Buy pasteurized or ultra-heated milk and dairy products. Check storage conditions and expiry dates. Also check if the milk product has been pasteurized. Do not drink probiotic products with live bacteria such as Yakult or Vitagen. In summary, here is a diagram on some good food safety practices. For more information on food safety, you may refer to www.sfa.gov.sg.